if we think about it, there's not an organ system that's not involved in an unfavorable way in people who are obese, and it is now considered a real and serious disease. Some of the, I would say, probably in our daily workday, we treat obesity-related problems all day long. For example, type 2 diabetes, high blood pressure, high cholesterol, something called metabolic syndrome, which we see in people who are obese, joint disease, arthritis. All these conditions are much more prevalent, and obesity is definitely a cofactor in most of these.
In 1995, the total cost of overweight and obesity to the United States economy totaled $52 billion. Type 2 diabetes alone was responsible for $32.4 billion. The costs associated with obesity are continuously increasing. In 2009, a staggering $147 billion in healthcare costs were obesity related.
The government system essentially consists of two components. One is Medicare, and the other is Medicaid. Medicare is a system that we all pay into from our first job, which is available to people either at age 62 or 65, depending on when they decide to go out on Medicare. Medicaid, on the other hand, is for patients who don't have insurance, many people who don't have jobs, and it is the mainstay of health care for many people in lower socioeconomic classes. And there's clearly an increased incidence of obesity in the lower socioeconomic classes, i.e. the Medicaid population.
A single obese patient spends $213 more on average for inpatient services compared to somebody of normal weight.
When we first started our practice close to 15 years ago, we did take Medicaid patients as well as all others, but unfortunately we had to stop accepting Medicaid because the cost of taking care of these patients was so astronomical, and because of their many comorbid disease states, that it was not feasible. We couldn't stay in practice. The cost was greater than we could meet to cover overhead. So most of the Medicaid patients have been shifted out of the private sector into hospital and community-run clinics.
The majority of our country under the age of 65 are insured through their employers. The problem with employee-based insurance is that premiums are at a set rate and are rarely adjusted based on individual terms. This is known as pooled insurance. Data shows that overweight and obese individuals pose a higher risk of becoming ill or injured. For a company that offers insurance, this draws red flags because they are responsible for that individual's medical bills. To combat this risk, employers are increasing their premiums to cover their own backs. It is simple to see how this system lacks any incentive for obese people to live a healthier lifestyle. If they are going to pay the same price as a person of healthy weight, then there are little incentives to lose weight. What we are now seeing happening is obese individuals are receiving lower pay from their employers. This shows how mildly obese workers earned an average of $1.27 less than those of normal weight. For morbidly obese individuals, they earn $2.22 less. According to the National Health and Nutrition Examination Survey, the highest prevalence of obesity is among those who are financially unstable and of low income. How is it possible that those who cannot afford food are obese?
One of the big factors is the cost of food. To eat healthy, to have a diet that's very rich in low-fat foods, vegetables, fruits, etc., is expensive. So a lot of these individuals rely on fast foods, which are less expensive, and on very calorie-dense foods, which are also a lot more available, more readily prepared, and also less in cost.
It is estimated that 1 in 8 Americans rely on food stamps. Multiple studies have shown that individuals on food stamps are more likely to be overweight. This tells us that the foods that are being purchased through this program are unhealthy, calorie-dense foods. Perhaps we can regulate the food stamps in regards to what foods can and cannot be purchased with them. Items that are high in calories and fat, such as soda, cookies, chips, and many processed foods, will not be covered under the food stamps. If the consumer wants to eat these items, then he or she will have to pay for them out of pocket. In doing so, this gives incentives for food stamp participants to spend their money wisely and make healthier choices.